Jessica. I'm going to be your student nurse today. So I'm going to go ahead and start by performing hand hygiene, ensuring privacy. I'm going to make sure that my room is well lit and comfortable for my patient. So can I go ahead and confirm your name and date of birth? Okay, and that's correct. So I know I have the right patient for this procedure. And do you have any allergies to betadine, latex, or tape? No. Okay, so my patient doesn't have any allergies to those, so that means this kit is good to go. I don't need to go find another one. Sorry, I'm out of breath. I just ran up my driveway. So, all right, so I'm gonna go ahead and get prepared for this. All right, so what we're gonna be doing today is a Foley catheter. If you're unsure of what that is, it's just a tube that I'm going to insert up into your bladder, and it's going to relieve any urine that is being retained in your bladder right now. It'll just help release that. So that's what we're going to do. It can be a little bit uncomfortable, but I'm going to talk you through this. If you have any questions, you can ask, and we're going to try to make this quick and easy. So I'm going to start by opening this kit away from me. I'm being careful to maintain sterile field by only touching these little 1-inch borders. So make sure that I do not contaminate this. And I have my kit up here because my table that I had, you couldn't see it in the video. So I have it pulled up here a little close to the patient. I wouldn't be this close in real life. I just want it to be on my video. All right, I'm gonna go ahead and just dispose of the parts that I don't need in this kit as I get to them. All right, I've got this. I'm going to be careful to only touch 1-inch borders. I've got the shiny side down. I'm just gonna lay this down to make sure, keep my area clean. All right, and I'm gonna go ahead and don sterile gloves. I'll pull those over here. You can try to see them. Okay, so now I'm sterile. I'm gonna go ahead and get what I can set up on my kit here before I move it down to the patient. So I've got my lubricant. I'm gonna go ahead and open this and just squeeze it in the corner of my box. I've got my swabs to clean. I'm gonna go ahead and remove those so they are out and ready for me. And I'm gonna go ahead and take the cap off of my water. Sterile water. Okay. All right, so now that I've got all of this ready, I'm gonna go ahead, and as I dispose of these things, I'm pulling them out and around to make sure that I do not reach over sterile field. So I'm gonna go ahead and move my box here. All right, now I'm gonna start by cleaning the area with my swab. So what I'm gonna do is take my non-dominant hand, I'm gonna open the labia, and I'm just gonna hold that open there, and I'm gonna go ahead and start with the labia furthest away from me, from top to bottom, and dispose. Now I'm gonna come to the labia closest to me, clean it from top to bottom, just one swipe, and I'm gonna reach out and around and dispose of that. And the last area I'm gonna get is the middle, so I'm gonna go from top to bottom, just one swipe, and dispose of that. Okay, and I would have taken this and also put this here. I should have taken this and left it on top of it for sterile field. And I also should have already attached my water. So now I'm having to do that, which would not be easy because I do not want to remove my dirty hand since it is no longer sterile. So I'm keeping my hand here, my dirty hand that's non-dominant, and now I've got my dominant hand here. Okay, so I've got this hooked up. I'm gonna go ahead, I've got my tip lubricated. I would be careful not to let this fly around everywhere, and I'm gonna go ahead and insert it. You may feel a little bit of discomfort, but if you'll just bear down, we're gonna get this done nice and quick. So I'm gonna go ahead and insert my catheter. Okay, and I see urine, so I'm gonna go in 1 to 2 more inches. This is a female patient. If it were a male, I would go in 3 to 4 more inches since they do have a longer urethra. Okay, so I'm just gonna go ahead and pinch the catheter here with my non-dominant hand, and I'm gonna go ahead and fill it up with the water that would stay attached to this. And we're gonna fill that up. Perfect. Okay, so I filled that up with water. I'm gonna go ahead and tug a little bit. It's nice and good in there, so we're gonna go ahead and let that go. All right, and I'm gonna take my sterile gloves off. Go ahead and don just some perform hand hygiene and just put clean gloves on. I'm gonna come on over here and I'm gonna go ahead and secure this to my patient's leg. I'll leave a little bit of slack so that it's not tugging on my patient, and then I'm gonna hang this down here on the hooks on a part of the bed that does not move. Okay, and then to go ahead and remove this catheter, I would have my gloves on. First thing I would do is go ahead and reattach my syringe. I would make sure that I draw out 10 milliliters of that so that it is completely empty, and go ahead and remove that catheter. I'll pop that off. I'll remove that catheter and dispose of it and perform any perineal care that is necessary.